Now I'm going to show you about 4 different exercises that may work for your pain. Now just remember, this does not take over the place of actually seeing a physical therapist in person, because a couple of these exercises are pretty standard for across the board diagnoses and presentations. However, the last 2 ones I'm going to show you may not be beneficial for everybody. The first exercise is single knee to chest. So with this one, all you're doing is bringing one knee towards your chest. And you want to put your arms around the thigh. You never want to put your hands on a joint like the knee like that, because it could bother you if you have any knee issues. So usually I like to do this. Now if you have pretty uncomfortable pain going on in the back, then I would leave the opposite leg up in a bent position. However, if you don't feel like you're getting a stretch and you feel like you can straighten the leg down like that to get a bigger stretch, as long as they're not increasing any of your back pain, that's okay. The key is that you try to keep your back flat into the surface that you're lying on, because once your back kind of arches up, if you're tight, that could cause pain. So try to keep your back flat. You're going to hold this for about 20 seconds. And then after 20 seconds, I usually like to switch and do the other side. And you want to do about 3 of them on each side for 20 seconds. The other stretch that's pretty good for most people is a hamstring stretch. I'm going to do it on my back because most people can do it on their back and it not be a problem. However, there are times where you might have to modify this into a different position. So with a hamstring stretch, if you have pretty decent flexibility, you can grab your thigh and then extend your knee towards the ceiling, like so your foot's aiming towards the ceiling. And you should feel pull behind the knee into the thigh, into the buttock area here. What you don't want to do is let the knee bend and bring that leg back towards this, because that's not really getting the hamstring at the knee part, because the hamstring crosses the knee as well as the back of the buttock area here. So if this is as far as you can get with your knee staying straight, that would be ideal. And you want to hold this as well for 20 seconds 3 times. So same thing like knee to the chest. I usually prefer, especially with this stretch, that the opposite leg is up, bent, because most people are pretty tight, and that will allow you to get a better stretch with the leg that you're using up in the air. Occasionally, if you're pretty flexible, you can lower the other leg. However, the back has to stay flat down onto the surface you're lying on so that it doesn't arch up. At least a small bend in the knee is usually the ideal way. And you'll hold this 20 seconds 3 times on each side as well. If you have trouble with grabbing with your arms because you're not super flexible, you can also use a towel, wrap it around your foot, and use your arms to pull it up that way. Or you can put the towel around your knee as well so that you're not holding with your arms. Because then if you're coming up like that, then you know you probably need some help because you don't want to strain your neck muscles. So the next 2 exercises are not ideal for everyone. Usually, if you're diagnosed with some sort of arthritic changes or spinal stenosis, which is narrowing of the spine, the canal where the nerves go through, you can do this first one. However, I would not recommend this for someone who's diagnosed with a bulging or herniated disc. This is called child's pose. This is a great stretch that a lot of people use in yoga. So you're just going to sit your butt back on your legs like this with your arms reaching out. And you're going to hold that 20 seconds 3 times. And then you would come up. You always want to take a few second break just to loosen up before you go into the next one. So this exercise is ideal more for patients that experience pain that radiates down into the butt area, maybe into the thigh or the lower leg. I would not recommend this for someone most of the time who has arthritic changes or stenosis because it's going to be more painful. So what you're going to do is you're going to take your forearms and place them on the surface that you're laying on your stomach, and then you're going to arch up your back. The biggest thing here is that you want to maintain your stomach on the surface. You don't want to push up like that because that's really not helpful. Here we're trying to extend the spine, and then you're going to come down. You can do a set of 10 of these. You can hold if you want for a couple seconds. You don't have to hold though for this one. And if you have pain that is actually radiating down your leg somewhere, the idea with this exercise is that it would actually start to decrease the radiation of pain and move it up towards your back. In addition, a lot of people that spend time sitting at work all day with a flexed back, this is something that's good for them in general to do, even if they're not complaining of pain, because it actually puts your spine in the opposite direction. We all know our spine is supposed to extend and bend, so if you spend so much time bending, your spine kind of forgets that they can extend. Remember, if you notice that you try something and it's making it worse, you do not want to continue to keep going through the exercise, you want to stop. But that's why we always recommend that you come in for the evaluation, because we can actually prescribe the correct exercise based on your presentation.